With the looming strike action by JHETSU, which is an umbrella body of all health workers unions and associations. The association is threatening to join the resident doctors on industrial action over welfare issues. In a notice to the Minister of Labour and Employment, Chris Ngige, JHETSU says it is giving the federal government 15 days to meet their demands for payment of all withheld salaries, review of the implementation of COVID-19 special inducement and hazard allowance, increase in retirement age from 60 to 65 years for health workers and 70 years for consultants, amongst other issues. The health workers say they have shown patriotism despite government's nonchalant attitude to their welfare. While the strike notice is coming 1 month after the Nigerian Association of Resident Doctors embarked on a yet-to-be-suspended indefinite strike.
Meanwhile, the Minister of Labour and Employment, Dr. Chris Ngige, says the federal government did its best to prevent the current strike by the National Association of Resident Doctors. Ngige claims the government took several steps to meet the demands of the doctors and says doctors and other health workers were paid bumper money as special COVID hazard allowance for 3 months in the first instance to the tune of 32 billion naira, while states were told to pay as much as they could afford. He gave a breakdown of what has happened in relation to the doctors' strike from September 2020 till date. The minister says 11.3 billion for group life insurance was approved in 2020 and renewed in 2021. He claims that a series of meetings were held on hazard allowance until there was disagreement between the doctors and the health workers union.
The government is doing everything possible to make sure they get back to work. Out of their 12-point issues raised in their demands, we have done all. We have come to agreements on all, including those that even affect the Medical and Dental Consultant Association of Nigeria and the medical doctors who are in academics and teaching in universities. So we have handled all. The only point of disagreement now is that they said that in the agreement, in the memorandum of action, government should include that Section 43 of the Trade Dispute Act will not apply to them. You have a right to strike, but your employer has also the right to withhold your emolument. In other climes, unions, before they go on strike, by that principle, they discuss with their workers and bring out what they call strike fund. And it's from that strike fund that the union will use to pay the workers that have gone on strike. And they will also even agree on the number of days the strike will last. That's why overseas and in other climes, you don't see strike getting more than 3 days or 4 days or 5 days highest. And much more importantly again, people on essential services, medical services in particular, where you can lose life, they don't go on strike anyhow.
Joining us now to discuss the issues in the healthcare sector in Nigeria is the Secretary General of the Nigerian Medical Association, Philip EKPE. Thank you so much, Philip, for being here with us tonight. And of course, for the fact that you're part of the negotiating team, meeting with the resident doctors and even NMA, you've given your own 21-day notice to the government, and JHETSU now is thinking of joining the strike. Why are we still having this impasse despite the negotiations being ongoing between both sides?
Well, thank you very much. Yes, truly negotiation has been ongoing per house in the past 4 to 6 months. So do you understand what that means? That means there is lack of implementation. Because, I mean, are we going to keep negotiating and negotiating and negotiating? Is there no end to negotiation? I mean, what of implementation? I'm sure you're aware that they've signed what they call, the NAD signed what they call Memorandum of Understanding. And after the federal government failed again in the implementation processes, they now sign what they call Memorandum of Action. In other words, they put out things that are actionable so that things can be done. And again, they failed again. And in failing to implement, the people have a right to protest. What else could they have done after they've written you and told you, look, this is what we agreed. You have not implemented. You are not implementing fast enough. It's not working, And instead of, okay, let's sit down again and look at it. Because to me too, this is about life. This is about health. This is about the masses, You shouldn't close the
But it's not
window.
looking like the doctors are concerned about the health of the masses, because at the end of the day, the resident doctors, we have seen reports of high fatalities.
It is the government that is not concerned about the masses, not the resident doctors. I will tell you one thing. Okay. If not for these negotiations, if not for the resident doctors and NMA, pointing out to government that this is what they're supposed to do, perhaps our healthcare system will be in shambles. And if you understand,
but isn't it in shambles?
We are the feedbacks.
Yeah.
No, this
Phillips.
maybe a temporary temporary shamble.
Phillips, yes. With NMA wanting to join the resident doctors, yes. And Johesu. That's a collapse of the entire health system. Is that good in a period of pandemic like this?
That sends a message that perhaps there's something wrong with the government, where if everybody now begin to think about going on strike, if people can't just jointly, it's not like NAD had a meeting with NMA and say, okay, go on strike first, after that NMA, after that Johesu. It just tells you that there's something fundamentally wrong with the system.
Okay.
But I will tell you that one of the major issues is implementation. Implementation is not being carried out. In Nigeria, you have a lot of policy papers, but the major issue is implement. And so we have to, after negotiating with you, we are now trying to push you to implement on time. Get it right. The resident doctors are not happy to go on strike. Their hands are tied. They gave ultimatum, isn't it? Did you negotiate before the ultimatum to see if you can call it off? These are the important things. You tell me that, okay, within the next 1 week, within the next 2 weeks, this is what's going to be done. And probably in 1 month, nothing is done. What do you want me to do? Make a fool of myself and just walk back? And then next time I come, you think I'm not serious? It's not, it's beyond how we're looking at it. We think about the masses. Honestly, it's paining all of us. It's paining NAD, it's paining NMA. That this has to happen. But government, government gives instruction. Government have the authority. So that is why it has to be in their hands. If it is NMA paying NAD, or if it's not paying itself, maybe there won't be strike at all. You understand? But government should have known the implication, the cost of collapse in the healthcare system.
How do we come out of this impasse now? Because I do know that industrial court had given an order that everyone should remain, everything should status quo, everything should be on status quo. And I do know that there's a hearing coming up on the 15th. How do we come out of this so that way we're not losing the lives of the poor Nigerians?
The National Industrial Court adjourned the case to 15th of September, and that hostility should end. And therefore, you should go back to status quo. Now, we in defining status quo is the state you were before you came to court. And that means, as you are trying to say, in short, let me explain further. That adjournment has given government a big latitude to quickly resolve the issue. You understand? And because it's now subjudice, it's not difficult for NAD and government side, particularly the Ministry of Labour and Employment, to come and sit down and discuss. That is why NMA came into it. That's okay, fine. We are really not a direct party to this dispute. Let us come into it. And we have had negotiations. We have signed an MOU, which there are certain places you have to implement. And we are giving 21 days for you to implement. We don't even hope to get to 21 days. As I'm talking, we're all working day and night to see that those MOUs are implemented. And I'll show you, to the government side, it's also working day and night. But the problem is that there are trust issues. You see, some months back, in April, I was in NTA. You have the Minister of Labour, he was there. The Minister of Health, State for Health was there. And the NAD President was there. And I told them that NAD will call off this strike. Enemy will prevail on NAD and talk to NAD, and we will talk to NAD and we'll call off this strike. And we're going to come back to this table. And this is where we are again. So,
Well, it's most unfortunate that the key players here are even doctors, talking about the Minister of Labor and Employment, the Minister of Health, Dr. Ehanire. Do you have a deja vu sense of sabotage here? Or just like you said, it's, the problem of implementation, not policy? Or do you have a sense, I mean, to some Nigerians, it is like two elephants fighting and the grass, the masses, are the people being trampled upon?
Your statement is like saying, funny enough, that all humans. You see, they're all doctors, but this one is Minister of Labor and Employment. This is Minister of Health. These are doctors practicing medicine, clinical medicine. So they're actually quite different. They have different schedule, different appraisal. You understand? However, they're expected to understand most. Unfortunately, everything is not in their hands. That is the truth. They also have to go back to their principal. They have to look at their ways. But like I'm telling you now, I don't even particularly think it's directly their fault. It's not directly the fault of Minister of Labor and Employment or the fault of the Minister of Health. It is implementation, the bottleneck, the logistics. But we are saying...
in the civil service.
Yes, but we are saying that health is a priority. If you think about it, every day, more than 50 persons are dying or having one morbidity or mortality or the other. And so for each day that passes, this is a time for government to put a waiver. Leave the bottleneck. After all, during COVID-19, when all of us were panicking, both doctors and non-doctors, both those, sure, Nigerians could not go to travel out. They removed all the waiver. They say employ. They even extended those who were supposed to retire and say, look, allow them to work. In the same situation, people are even dying more now than the COVID period.
Why is that so?
No, because you see...
as a medical doctor, why?
I will tell you why.
Good.
You see, you're only referring to COVID. Do you understand? This time around, you are referring to spectrum of diseases, including cancer and all sorts of things that needed to be attended to. Before, I mean, apart from COVID, we were attending to other things. But now, they're not attending to any treatment, especially NAD. Why? Because NAD is the engine room of the healthcare system. That the first level as house officer, that the second level as senior house officer, that the third level as registrar 2, that the fourth level as registrar 1, that the fifth level as senior registrar 2, that the seventh level as senior registrar 1, before you become a consultant. So these are the people.
Well, even COVID-19 was seeing a higher death rate because within 24 hours, last week Wednesday, we saw 95 people that died. So we need to see an end to this impasse. We'd have to say thank you so much.
If you want to take the statistics, take the statistics also within that number of days. How many people died in the country from different diseases? So 95 is just very small compared to the number. But what we are saying is that government need to act fast.
Absolutely.
Absolutely,
yes.
you're
Good place to leave the conversation.
And remember too, I just want to add something. Government have not said that their demand is illegitimate. Government have acknowledged that their demand
and they're
is
working on
legitimate.
getting it done.
Phillips
EKPE,
they also agree.
General Secretary, Nigerian Medical Association. Secretary General, Nigerian Medical Association. Thank you for joining us tonight.